Hey everyone, welcome back to the Neural Health broadcast for another great episode. Today we are joined by Natasha Wilch as we discuss all things post concussion syndrome. A lot of people who seek help through functional neurologists do tend to suffer with post concussion syndrome, and this is one of the things that functional neurologists are really able to help. So, whether you have been struggling for a month or multiple years, there is still hope. And hopefully, by the end of this episode, you'll have a better understanding of what a functional neurologist might have to offer in the realm of post concussion, what an exam would look like, what treatment might look like, so on and so forth. So, after a quick announcement, we're going to get right into it with post concussion syndrome with Natasha Wilch. This podcast is brought to you by Delta Neural Health, located in Columbus, Ohio, where non-invasive, personalized care is revolutionizing the way we approach complex neurological issues. With cutting-edge techniques in functional neurology, functional medicine, and chiropractic care, we're leading the way in managing conditions like concussion, dizziness, brain fog, anxiety, POTS, attention, and more. To learn more, visit our website at deltaneuralhealth.com. Hey everyone, welcome back to the show. Today we are joined by Natasha Wilch. Thank you for joining us today.
Oh, it is my pleasure to be here.
So Natasha, we are about to talk about concussion, which is something that you and I see quite a bit of. Can you tell us a little bit about how you got into the world of concussion in the first place?
Yeah, this is a topic that I could talk about forever. It's what my whole career is, and similar to you, it's what my whole career is based around, to be honest. It is very near and dear to my heart. Um, I I do it through both my clinic and then online programs that I run, and I mentor clinicians in the space as well. But the kind of I always say like the heart of like the pit of my fiery passion, it comes 17. My dad actually had a brain injury, and it definitely upheavaled our family dynamic in our lives for a few years, and this was 20 some odd years ago at this point, to be honest. So no one explained to my family or 17-year-old me what that meant. And we kind of had to live that out as a family. And then when I became a therapist, so I'm a physical therapist, and my first concussion was randomly referred to me because I was the only neurophysio in town. And this poor client was experiencing PCS. And so the OT at the time was just like, well, Natasha's a neurophysio, concussion's a brain. Let's send her to Natasha. I knew no idea.
Hmm.
This was back in 2017, and I had not a freaking clue what to do.
Hmm.
But literally, what this client did was kind of reignite that fire for me, and I jumped down the rabbit hole, and I've never looked back.
Hmm.
So,
And now my background is in chiropractic prior
mhm.
to the Carrick Institute work and the functional neurology work. Yours is in physical therapy,
Physical therapy.
physiotherapy.
Yep.
Would you say that, and I gather from your previous answer that that physical therapists or physiotherapists get adequate education in concussion management and rehabilitation out of school? Because I could say from a chiropractic standpoint, not so much, right?
Uh, we definitely do not.
Hmm.
It's probably similar to Cairo. I'm totally making this assumption, but
Hmm.
I always say in physio, you get one 60-minute lecture, and in that lecture, every concussion is better in 3 days,
That's right.
which you and I both know is very much not
Yep, definitely not the
the
case.
case.
So, so even though we kind of started with kind of different origins, pretty similar, but
Yeah,
different
different skill
origins,
sets.
right? We converged in this world of functional neurology to gain our understanding and our kind of proficiency over concussion rehab and
Yeah.
assessment. So, can you talk to us about how you stumbled into that world?
Oh, that is a story. Um, and I will never forget it actually. So yeah, I totally can. So do you remember do you remember Players Tribune and way back when Dan Carcillo did that Players Tribune episode with Matt Antonucci and like that team at Plasticity and all that?
I do. Yep.
So at about that time, I was in my clinical practice and I was getting super frustrated because I was looking for answers to explain things that no one could explain to me.
Hmm.
And when I was searching within my own profession of options and what to do and where to go, like I couldn't find anything. And then literally one of my best friends sent me this Player Tribune video and I watched it and I was just like, this looks super cool. And I'd recognized some of the tests that they were doing,
Hmm.
but I'm like, something feels different. And so I think I watched that video like 3 times because it doesn't say where he goes in the video, but there's
Hmm.
one spot where it like slow pans past the entrance to Plasticity.
Oh yeah.
So I found that. So I like literally watched it 3 times, found that, Googled Plasticity, realized that it only existed in Orlando, Florida,
Hmm.
pulled up who like the team was, emailed the clinic and said, you have no idea who I am. I'm from Western Canada, but do you ever let people come shadow? And she was like, yeah, we sure do. Here, like take some information, sign this form. And so when she sent me the information to go shadow at Matt's clinic, that was the first time I'd ever heard the term functional neurology before.
Hmm.
I'd never seen it, which is actually really funny because when I look back, Dr. Carrick was like starting to show up on all my feeds in
Yeah.
my like, and I was like, who is this person? Close, close.
That's
uh,
insignificant.
right? I'm like, this, I don't need to know what this is.
Right.
And then I'm always like the universe priming me, right?
Hmm.
Um, and so then I started searching, well, functional neurology courses in Canada, they don't exist.
Hmm.
And then it was like, so I was like, functional neurology in the United States, and up popped the Carrick Institute.
Hmm.
And so then I called the Institute and had a conversation with Freddie's, and he kind of explained what FN was all about. And they were just launching receptor-based essentials at that time. Like they were
Hmm.
just about to pilot it. And I enrolled. And back then, that's like that pilot program required me. So I'm Western Canada and like Vancouver Island, as far west as you can get from Orlando.
Hmm.
And it required me to fly to Florida 5 different times over a period of 10 months to do that program.
Hmm. That's
Um,
commitment.
but I did it.
Yeah.
And so me being me, also every time I went over there, because I'd already talked to Plasticity about shadowing,
Hmm.
I went and shadowed Matt after every chunk of time in that when I was in Orlando as well together. I'm like, if I'm flying across 2 countries,
Hmm. You
I'm
might as
gonna
well
get
get
the
your
most
money's
out of
worth,
my
right?
time. And that's how I stumbled across functional neurology. That was my introduction into functional neurology, um, and now I'm hooked.
Yeah. And now you're a leading voice in the field. So this is fantastic. Very full circle.
It is. Yeah.
Um, so since going through the courses and implementing it into your practice, uh, would you say you feel more confident and competent in treating those with concussions or working with those with concussion?
Yeah, it's super funny because I literally just sent out an email to my mailing list yesterday because I have my own mentorship program to support kind of people. And
Hmm.
uh, I literally just sent out an email yesterday about how powerful mentorship is and how the first time I invested, by the time receptor-based essentials was done, I'd invested about $20,000 into that program
Hmm.
when you include all the factors. And I said, that's a lot of money for someone to invest in something.
Yeah.
And I said, but I don't regret it for a second because literally that program and the friendships I've made, and like Matt's still a very dear mentor to me today, um, it changed the trajectory of my career.
Hmm.
Like 100% changed the trajectory of my career. I would not be, I feel on a credit to like that moment and that decision, I wouldn't be where I am today without it.
Hmm.
And then since the beautiful thing is functional neurology is so amazing at helping us understand the neurophysiology and breaking it down into the microscopic element and doing those like understanding that piece of thing, like that is that its strength, like hands down. And so the cool thing for me is I've been able to take that and thread that with the stuff I do around mindset and the stuff I do. I'm a very like trauma informed therapist too, and I'm a very compassionate therapist, as most people are, but I've been able to take that neurophysiology and thread it into the mindset work I do, the compassion stuff I do, the exercise stuff I do, and it just like melded. It's like there was this piece that was like, I mean, we never stop learning,
Mhm.
uh, but hands down was such a crucial piece to the development of who I am today, for sure.
Yeah. And I often think about that scene in The Matrix where Morpheus is about to hand Neo the red pill or the blue pill.
Yeah.
And I feel like you find functional neurology and you can either A, take the red pill and go down this rabbit hole that, leads you into so much. It's never ending.
It doesn't ever
Um,
stop.
and changes the trajectory of your career and the way you practice and see patients. Or you can take the blue pill, appreciate that it existed maybe, and then go about your business. So I
Yeah.
think you and I both decided to take that red pill here, and now here we are.
Well, and I think what's really unfortunate, and it's like I always love when we get in this like chirophysio situation because I feel like sometimes in physio school and in chiro school, we're taught to headbutt with each other,
Hmm.
which is really sad.
Yeah.
And I value collaborative care and being able to like learn through different perspectives and lenses. And I think that's what also contributes to a very well-rounded, open-minded therapist.
Hmm.
And I remember when I first enrolled in functional neurology, because again, it's for some reason the term had people don't like the term.
Hmm.
Um, and I remember getting questions from like my colleagues being like, Natasha, are you sure? Like, there's just this skepticism and like from the physical therapy profession in looking at functional neurology and in looking at chiropractic sometimes as a whole. And I think it's for me, I'm just like, well, A, I'm going to make my own decision.
Hmm.
But B, I also just think there's a complete lack of awareness of what functional neurology truly is. Right. And I think when people understand that functional neurology is literally us being able to take the neurophysiology and break it down and then apply that into function, it's all evidence-based.
Yeah.
It's all science.
Hmm.
It's all like, and when people see that, then they start to shift. But for some reason, there's just this like, I don't know, not that there's this hesitate, this skepticism,
Hmm.
at least from my profession looking in,
Yeah.
which is very sad and unfortunate.
Yeah. And I think I mean this is a great thing, but sometimes it almost feels to the untrained eye, it might seem like voodoo or magic that somebody's trying to do. But like I said, it's all very evidence-based and science-based. So when you can, perform a vestibular therapy and all of a sudden somebody can see straight again,
Right?
after one maneuver or one therapy, it seems pretty bizarre.
Hmm.
But there is a very strong evidence and rationale for why you did that. And
Exactly.
but it kind of feels like magic sometimes. Not every time, of course, but it can be, kind of hard to believe, I think, from an outside perspective.
Well, and I think too, it's when we get those clients where, I mean, I see a lot of persistent on my caseload, which I'm assuming you do as well, right? So we're seeing those clients who've been on this persistent concussion journey for years.
Hmm.
And when you can objectively, and so we do the 1 week intensives up at my clinic.
Hmm.
And when you can get more change in that client in 1 week than they've had in 7 years, then it also feels a bit like, what just happened?
Yeah, it's hard
That's
to accept the change too sometimes.
Yeah, but that is I always just say to people, like, that's the
Hmm.
beauty of understanding things to the level that
Yeah.
functionality gets to teach us.
Hmm.
And that then we get to integrate and learn and know because we have that deeper understanding. We can be more specific.
Hmm.
We can bring things down to a finer micro level
Hmm.
to then build things back up. That's kind of how I describe it a lot to people.
Yeah.
Uh, and it gives us that ability and that knowledge to be able to do that.
Hmm. Exactly. Now, when you are when you have a concussion patient that enters your clinic, say for your intensive week, where do you start? What does your assessment look like?
Yeah, so I always describe it as like the integrated multi-systems assessment, right? So we're looking at all the systems. So we have the different assessment teams we like. So we're looking at the autonomics, we're looking at vision, vestibular, somatosensory, cervical spine, affective, and we're doing a cognitive screen. And then from there, um, dependent on what we're finding, we look at, what is the root piece that could be feeding into all these other pieces, and then that's where we start.
Mhm.
I just gave the example of like the common example of like unresolving neck tension in the clinic because everyone can relate to that one. And how someone might be having, like, they're getting manual therapy and they're getting massage and the neck is tense, but then it feels good for a day, but then it goes back to being tense. Well, it's like something else is driving the neck. And so I explained to clients, like, we know the neck is an issue and we know the neck is contributing to your headaches, but something else is driving the neck. So we need to treat the thing that
Mhm.
drives the neck to resolve the neck, to resolve the symptom from the neck.
Right.
And so explaining it that way to our clients too is like, that's what this full systems assessment that we do lets us figure out.
Mhm.
And then we build a treatment plan from there.
Yeah, you really have to start unraveling kind of the threads and like, okay, this is the fray at the top of the yarn heap or whatever, but then you pull it and then it's okay, there's a knot here you have to untie. So there's a really in-depth evaluation that really needs to take place to be able to administer individualized and effective care for these patients.
I would agree.
Yeah.
And I
S-
think I get so many questions and messages on Instagram being like, this, I've been on this journey, like, this is what I'm doing, like, what do I do?
mhm,
And my first question is always like, have you connected with a provider that is able to kind of step back and look at all your systems together
mhm,
and give a picture? I'm like, because if that hasn't happened for you yet, then that's where
mhm.
we need to connect you with somebody.
Yeah.
That's kind of
Yeah.
always my go-to answer.
And there's so many different facets of concussion, and you just listed off all of the different evaluation diagnostic tools
Mhm.
that you use. And, no one else is really doing that. Not to, say anything about other professions, but typically you go to an optometrist, they're going to look at your eyes. A neurooptometrist, they might look at the way your eyes are moving. Um, vestibular therapist is going to be focused on the vestibular system. Your chiropractor, your physio might be focused on the somatosensory system, but no one's really putting these together, and understanding and trying to understand how do these interwork with each other and what can we do to address them in a hierarchical fashion.
Yeah, I mean, you would say when you look at how we're all trained in the healthcare system, it trains us to be siloed,
Hmm.
right? So I always say to the clinicians I mentor too, like, it's not your fault that you don't understand, that you don't know how to do. I always call it like this dance and this weaving of the systems and this truly integrative approach that we take, because that's not how we're taught. Like,
Yeah.
we're truly, like, when you look at the healthcare system as a whole, everything is silent. Neurologists don't speak to rheumatologists, don't speak to cardiologists,
Hmm.
right? Like PT, like, versus the approach we take is very integrative.
Yeah.
Um, and having that ability. And then say at the same time, like, we recognize where our weaknesses are. So we know that if someone does need, to go into prisms or something like that, like, we then have our network to refer to. It's not
Hmm.
that we don't respect the other professions, because we absolutely do, but we have that ability to really take that big picture lens to see how these things interact and then know when to refer out or pull extra team members in to complement the client. So
Yeah.
I would say, like, we almost become like a coach
Mhm.
or the quarterback to then splay things out from there too.
Exactly, because triaging to the appropriate provider, we don't do everything, like you said.
Exactly.
So knowing who does those things and having a good relationship with them and, to get the patient the best results possible is obviously the utmost importance. Um, and then once you perform your evaluation, you've got a great picture of how the person's brain is functioning physiologically. What is your next step then to deliver treatment? And what do those treatments look like?
Yeah, so we do the way our basic structure is we do 15 sessions within a week. We do 3 sessions a day. They're 60 minutes each.
Mhm.
So the Monday is typically assessment focused. And then from there, we'll build out, okay, here's where I always say this is my starting treatment plan, because I always end up changing
Mhm.
it based on like what's happening or how the client is responding. Because again, it's like I can have the best laid of intentions, and then when I put my hands on someone or when we go to do something, things might shift.
Mhm.
Um, but then literally it's treatment for the next, 3 days, and then we reassess on the Friday, and build a custom home program to send our clients home with. But the treatment is very much based on that assessment,
Mhm.
right? So what did we find is kind of those fundamental like root pieces we need to address first, and how do we address them in a way that we ensure we're not pushing our client, like, past their capacity as well. So
Mhm.
there is a lot of like dancing between things and letting things build and summate, and then while also incorporating rest throughout the sessions, whether that be getting them to breathe in palm while I'm getting the next piece of equipment ready or whatever that is. Um, and then obviously the one thing I love about intensives is like we can make micro challenges throughout each session
Hmm.
that then accumulate throughout the week of like these big changes, versus if we just saw someone once a week, you can't micro challenge in that same way because you just lose it.
Hmm.
So that is why I love intensives as well. It just, and why I think it just lets us get so much more out of the same amount of financial investment for the client for a greater change in a shorter period of time.
Hmm. No, exactly. And I love that you mentioned that the therapies and the treatments are totally dependent on your exam, right? And it may not be and it's not going to be a static process. Like you could, after the exam, have a great idea of what you think would work, which
And
has
then
worked
it goes,
for X number of people, but for that person, it doesn't work. So that's where we have to be clever and creative, and the art kind of comes in and the experience comes
absolutely.
in to adjust our approach to fit the patient and their particular metabolic capacity and their needs. So it's a dance that constantly
Yeah,
goes on, especially in an intensive week. Um,
absolutely.
yeah. And then so the patient goes through a week of therapy with you, and
Yeah.
then they perform the re-exam.
Yeah.
Obviously, we hope to see both symptomatic and objective change by the end of the week.
Yes.
And then you had mentioned creating that follow-up at-home care plan for them.
Yeah.
How do you structure that with your patients?
Yeah, so with the clients, so we actually provide our program is a week in clinic and then like 3 months follow up virtually is what
Mhm.
our full program is. Because I find, and I always explain to people that intensive week is a huge, it's not a cure, but it's a big, like giant stepping stone or leap forward depending on the client. But then the work they continue when they get home, like that's they're going to continue to see change and progress.
Mhm.
And so sometimes that biggest, like they have a huge chunk of change when they're with us. And then each month they're just like continuing to leap bound. And I find that with my clients, like they notice things when they leave, but then it's like 3 months down the road, they're like, Natasha, they're like, holy crap, like this is what I could do. And so for us, we build this custom home program based on what we've been doing, always based on what we've been doing in clinic, and then on reassessment, there'll be some tweaks. And then we always follow up with someone about 2 weeks later, because the beautiful things about intensives too is like you're in this nice little bubble, right? Like the rest of the world gets to just like be quiet for a week and you get to focus on you because
Mhm.
everything else is taken care of. And when you leave that intensive bubble and you go home, life happens again.
Mhm.
And every intensive client has different levels of life stress. So we always follow up within a week and a half to 2 weeks after our client's home because we want to help them reacclimatize back into life. And then also we almost always have to do some tweaking and some adjusting on what that home program was because now they're not in their bubble. And things change. So then we support them that way. And then the beautiful thing through having that 3 month follow up as well is if things come up around how we have to guide through exercise or guide through energy conservation or work on some mindset stuff, we can start to incorporate it more into that 3 month post because you can't do everything in a week. You
Mhm.
just can't.
Right.
And so there's also always that question of clients are like, well, how many times do I have to come back? And I was like, truly, it depends on your starting point.
Yeah. Yeah.
Right?
Hmm.
Like, like you can support, guide, and I want to say like increase the rate of healing, but only to an extent. Like healing is healing.
Yeah.
And so dependent on when the question of like, well, how many times am I gonna have to come back? I'm like, well, it truly depends on where you're starting from
Hmm.
and how
Yeah.
well we integrate and like all like I don't have a magic ball. There is no like solid answer. I have people that
Hmm.
come once and are solid, and I have people that have come 3 or 4 times because they'd been on this journey for so long and had such things we were working on that was like it's leaps every time, but it takes more than one time.
Yeah. Yeah. And like you mentioned, um, every patient's different. Every brain injury is different. Everybody has a different starting point, like you said. So, is somebody 80 years old or are they 16 years old? Have they had one concussion? Have they had 13 concussions?
Yeah.
Are they really good with their diet, or are they just eating kind of your standard American diet? Or I don't know if you have the standard Canadian diet, if it's any
I'm
better,
gonna say
but
it's probably pretty similar to the standard American diet.
uh-huh.
It's terrible.
Yeah. So all of those things play a factor. And so, yes, you're going to give that person a huge leg up in that week, but really there's a lot of responsibility then that needs to be taken in order to continue to improve that progress. Because, neuroplasticity can work very quickly, but we need to retain those changes and make them permanent with
Yeah.
repetition. So,
Yeah, I agree.
um, and I'm just gonna pause. So if a client is still struggling, what then do you recommend?
So I think the biggest thing is that we don't ever want them to lose hope, right? Like remembering that, like we talked about, neuroplasticity is a thing, the brain is not fixed. And regardless of whether you've been a few weeks or whether you're most of the clients that you and I get to see in our practice that have been years, it is never too late to heal.
Mhm.
Um, I feel like so many of our clients hear like, this is the way you have to be. This is your new normal. You just need to get with it. And honestly, it's bull. And so I think if there's clients listening to this, or if there's clinicians listening to this, don't ever be the clinician that tells someone this is as good as they're going to be, because who are we? Healing happens in so many different ways, right? Whether it's from like the neurophysiology piece, whether it's from the spirituality piece, whatever it is, healing can happen in so many different ways that we don't fully understand. Who are we to ever tell someone that they're not going to heal any further, right? Or they're not going to grow. So if you're a clinician listening to this, don't ever say
Mhm.
that. But if you're a client or you're a patient, I think it would be kind of what we talked about earlier, which is the importance of, A, don't give up.
Mhm.
But B, find somebody who can do what you and I do, right? Find somebody who can take that step back and look at you as a whole integrated being, not just a system.
Yeah.
And let's start from zero. Let's do this fresh kind of assessment and let's see what we see. And then let's have a discussion on the elements that can help you take that next step further in your healing.
Yep. Exactly. Yeah, there's always another option. There's always options. So you've never tried everything. Most people feel like they have, especially by the time they get to us, but
Yes.
definitely have not tried everything. So yes, like you said, keep the hope, keep pushing, keep trying. So for those listening who are struggling with post-concussion syndrome, how would they find out more about yourself and the services you offer?
Yeah, the easiest way is Instagram, honestly. So it's just at natasha.wilch. I am in my DMs all the time. We post content regularly. That's 100% just the best way to find me. We also have a
Perfect.
podcast as well. Ours is called the Concussion Nerds Podcast.
Awesome.
It's also a resource too. So those would be the two ways.
Awesome. And you are located in Western Canada.
I am in
So
Little Nanaimo, British Columbia.
yeah, a beautiful place to do an intensive, I'm sure.
In the summer, it's gorgeous.
In the summer, it's gorgeous. Okay.
The winter, it's gray, but it's
Mhm.
still lovely.
Yeah, awesome. Yeah, I'm
Yeah,
excited. I haven't made my way up there as yet, but I'd love to check out BC. So
you definitely should.
all right. Well, Natasha, thank you again for coming on today. This was really informative, and those who are struggling with concussion are going to really have a good idea about what functional neurology is, what they can expect, and really come up with a good game plan going forward, I think, and rekindling that hope, like we mentioned. So thank you
Awesome.
again.
Thank you so much for having me.
Of course. Well, until next time, take
Yeah.
care.
Bye.